I'd like to continue with a story that actually begins in my 6-year-old son's dress-up box, where he has all kinds of costumes. All the requisite superheroes are there, Superman and Batman and so on. He also has a doctor get-up. And of course, the absolutely essential prop, if you wish to dress up like a doctor, is the stethoscope. Interesting thing about that is that my son's generation will likely be the last to need that particular prop, because the stethoscope is going the way of the horse and buggy. It will be replaced by pocket-sized ultrasound devices that look a lot like your mobile phone. Now, this is an interesting innovation story, not because of the technology, but because of what it has to tell us about where we might look for breakthrough ideas that have the potential to transform healthcare. This is a technology, in fact, that was developed in China for China. First, they wanted something that had decent image quality, but was very inexpensive. The second criteria was portability, because in rural China, you can't always get the patient to the clinic. Sometimes you have to take the device to the patient. The third thing that was needed was ease of use. This is nothing but a standard laptop computer with a USB ultrasound probe. Okay? Because it used standard hardware, it was dirt cheap. Okay? Because it was a laptop, it was very portable. Okay? And because it had a very intuitive software interface, it was quite easy to use. Because it met these criteria, these devices were picked up and used very quickly in China. But here's the thing that nobody anticipated. Okay? They also were very quickly picked up and used in rich nations. The initial thinking was that that wouldn't possibly happen, right? Because the image quality wasn't good enough. It didn't meet our standards. Okay? But these devices very quickly found their way into applications where portability was quite valuable. Think about the back of ambulances, or in emergency rooms, or even in operating rooms. Okay? The most important thing about this story is that this was an innovation that originated in the developing world and later found its way to the rich world. What that makes it is what I call a reverse innovation. What we have seen is that reverse innovation is on the rise, and it's on a rapid rise. And in fact, we believe it will define the next phase of globalization. Any innovation is just a solution to a problem. So you might expect reverse innovation anytime you have a problem appear in the developing world before it appears in the rich world. If we're facing a decade of austerity in the NHS, why wouldn't we look for inspiration to nations where resources are even more tightly constrained? For innovations to spread, there has to be social contact between early innovators and those that can adopt later. So I ask you, what is the UK doing to close the social distance between innovation leaders in this country and their counterparts in India and China and Brazil? I have a quick analogy to share with you. I'm a guy who enjoys a good hike, but I've always dreamed of tackling a real mountain. Okay? Maybe this one. This is Mount Rainier in the northwest United States. Okay? I haven't done it yet. Maybe someday I will, but at least I've talked to a few people who have. And in doing so, I've learned something very important. Okay? I've learned that there's a big difference between an expert mountaineer and a novice. And that difference, quite simply, is that the novice celebrates at the top. Think about it. Okay? The expert understands that you don't celebrate till you get back down to the bottom. Okay? So why do I tell you this? Well, I tell you this because there is a Mount Rainier-like summit at every innovation journey. And it happens at that moment when you say, by gosh, that's a fantastic idea. Okay? Let's take that forward. Let's make things happen. And you know, getting to that point of commitment can involve an enormous amount of work. And it is on the other side of innovation that you'll find all of the hidden dangers and all of the unexpected pitfalls. We pay way too little attention to the other side of innovation. How is the innovation work going to get done, given that people are so darn busy? I find it very helpful in thinking about this to show a two-dimensional pie chart. It's very simple. On the x-axis here, we have people in your organization from 0 to 100%. On the y-axis, we have time from 0 to 100%. Now, people are very busy. They're very busy with day-to-day work. So let's put that on the pie chart first. I figure it looks something like this. Okay? So when companies talk about a culture of innovation, implicitly they are imagining that the innovation work can somehow be squeezed into those tiny little slivers of slack time that exist in every organization. This can actually work, and it can be very powerful, just so long as what we're hoping to accomplish is to implement a very large number of very small projects. Okay? What happens if instead we create a dedicated team? Okay? A small group of people that is committed full-time to a single innovation initiative. 75% of the room at least is thinking, my gosh, too expensive. How can we possibly create a dedicated team? Even though if it's a 3-man-year project, whether you put 3 people on it for a year or 30 people on the project for 10% of their time for a year, it's still a 3-man-year project. It's the same. It's only by creating dedicated teams that you get breakthrough organizational design. And I believe a lot of innovations in healthcare delivery are going to need that kind of breakthrough organizational design. The dedicated team, as important as it is never the whole story. Innovations almost always build on at least something that already exists, and therefore a good innovation team is inevitably a partnership between the dedicated team and another group I'll call the shared staff. Now, the shared staff, as the name implies, does 2 jobs. It does double duty. It is both responsible for day-to-day operations and for supporting innovation. Because of its commitment to excellence in day-to-day operations, it has very little flexibility. And it can only take on tasks that fit naturally within its existing work processes. The best innovation teams are partnerships between the dedicated team and the shared staff.